Okay, I am Dr. John Davis Akkara from Arvind Eye Hospital, Pondicherry. My topic is the review of smartphone apps in ophthalmology. I have no financial disclosures to make. So smartphones and internet, they have become more and more accessible, affordable, and almost like essentials of daily life. They replace expensive and bulky equipments. They have very portable, updatable, upgradable, multi-purpose, and replaceable. Can you put it back? Yeah. So, shall I continue? So there are many types of smartphone apps available, and there are many categories. So patient testing apps, ophthalmic calculators, patient education apps, ophthalmologist education apps, ophthalmologist reference apps, and electronic medical record apps. Now the most important ones for us as clinicians are patient testing apps and ophthalmic calculators. And there are so many such apps. So we reviewed 24 such apps and we classified into eye testing apps, patient helper apps, calculation and grading apps, and advanced eye testing apps. And then we found the best app for comprehensive eye testing, that is having multiple eye tests in a single app, was the Eye Handbook, where there are multiple tests for patient testing, including visual acuity, contrast sensitivity, color vision. Even the optokinetic nystagmus drum was there as an app in the single app. Including that, there were calculators and also discussion forums, iAtlas. So that is why we have decided this is the most comprehensive app. Then we saw the best apps for eye surgeons. So there are IOL calculators. There is toric IOL calculator, which does both IOL calculations as well as toric IOL calculations. Then there is the Eye Toric app, which uses the phone's gyroscope to help you in marking the toric markings. You can take a photograph of the patient's eye and adjust the markings based on the gyroscope present in the phone. Then there is a surgically induced astigmatism calculator for a surgeon to tailor his incisions. Then for the specialized eye testing apps, there is the Eye Chart Pro, which has a very good feature that it can connect a tablet, an iPad, and a phone or iPhone, and wirelessly you can control the screen. So you keep the iPad at a distance of 6 meters, you sit at your table and control the display from where you are sitting. Then there is a Peak app, which is from a UK based company which has done extensive tests in Africa, which is very useful method of testing the patient's vision in rural setting. It has e-charts which you just swipe and it gives you the calculations. Then color vision, there are many apps for Ishihara's chart. In addition, we found that even the Farnsworth-Munsell 100 hue test, which is a specialized vision testing, is also available as an app. So that was there. And then there is also the color contrast tester, that is the hue testing. Then for advanced testing, there is stereo acuity testing app. So you may think that to check stereo acuity you might need to get a specialized kit which costs 20,000 rupees, but you don't need that. You can use your phone inside a virtual reality headset, and these two apps, the stereo tab and the stereo acuity test for cardboard, can test visual acuity by using just your regular smartphone. And then also the optokinetic nystagmus app was found to be a very good advanced testing app, which has adjustable width of strips. Then for visual field testing, this is another area which was an advanced test which we may not know that is possible. There is one app called the Visual Fields EC for iPad. These are all free apps which can do visual field using an iPad. And now I am working on another app which can do visual field testing inside a smartphone kept inside a virtual reality headset, which we are calling Periscreener. So this is going to be much better than the iPad based visual fields. Then there is, for ophthalmic calculations, we go back to the same app, the Eye Handbook app. It has an extensive collection of ophthalmic calculators, including toric calculations, IOP to CCT conversion, and conversion of visual acuity from one format to the other. For teaching, VR human eye, VR 3D human eye, we can show the anatomy of the eyeball, rotate it around and show the parts and see and teach easily. For clinical grading, I couldn't find any comprehensive apps, but there was an LOCS 3 grading app. And for fundus photography, camera FV5 and open camera. For patient glaucoma and other diseases which need adherence, my eye drops and glaucoma apps. And we see that many types of things apps can do, but are they reliable? We see that there is a study for at least the color vision test. There was a study which showed that further validation is required because they have different sensitivity for detection depending on the phone used. So we conclude that there are several free apps, some paid apps, few multi-purpose apps, some specialized apps. They are convenient but often not standardized. Many innovative features are there, but we still need to standardize and validate these apps. Thank you.
Are you using these apps for patient education?
Patient education, I have not started using them because I work in a busy OPD, but I have used some of these apps for bedside testing of patients' vision and color vision. In fact, even in the OPD, when the ECRS chart is not available, I just open up my app and check the visual in color vision, because oftentimes there is one ECRS book which is in somewhere.
Yeah.
So we use it, yes.
So how you feel that the detection of the color vision defect?
The color vision, I find that it is much better than the Indian version of the ECRS chart which we have here. The actual ECRS is expensive, we don't have that.
But how many slides they have?
All 38 slides are there.
All are there.
All 38 slides are there.
Okay. Thank you. So now
Thank you. The next